The lights are out, the windows are darkened, and the pharmacist is dressed in black. A protest on England's high streets over closures and funding. Next is an unprecedented ballot on working to rule in England, Wales and Northern Ireland, called today by the National Pharmacy Association.
In England, 7 pharmacies are closing a week, 3/4 are in the red, and that's because there's a £1.3 billion funding black hole. In effect, over the last 10 years, there's been a real terms cut in funding of 40%.
How many you need?
This is not a union, so work to rule can only be advisory, but could see pharmacies opening for the minimum number of hours and withdrawing free deliveries for medication. All of this is happening at a time when pharmacies are being asked to do more. In January, Pharmacy First was introduced in England. Scotland had already led the way. Nobody would dispute the concept of Pharmacy First. After all, we know what pressure GPs are under, but through freedom of information requests made by Channel 4 News, we can see that in ministerial meetings, as they were discussing setting it up, questions were raised about patient data sharing, about getting the information out to GPs so they encouraged the service, and about the funding model. The idea is community pharmacies can now care and prescribe for 7 common conditions, including earaches, sore throats and urinary tract infections. But according to the FOIs, which Channel 4 News had to appeal to have released, concerns were raised by the Royal College of GPs over the shortage of pharmacists, infrastructure issues, IT incompatibility between GPs and pharmacies, and potential confidentiality issues if doing consultations in the pharmacy. The Chief Medical Officer is quoted as strongly stating concerns about pharmacies increasing prescribing of broad-spectrum antibiotics as the single biggest risk to antimicrobial resistance in the UK.
I would say, oh, I'm pregnant and I have a sore throat, for example.
Shortly after it was set up, Catherine Edwards, who was training to be a pharmacist, took part in a mystery shopping exercise to look at how the scheme was working.
In general, I feel like the pharmacies didn't necessarily perform well. It's understandable. One pharmacist said he got training 1 week before he was meant to provide this service. He didn't feel like he could train all his staff in that time, especially when they're meant to be providing the normal pharmacy services for the full day as well.
In the same FOIs, we learned of a warning from civil servants that while a similar scheme in Scotland had been broadly successful because of growing investment in the pharmacy sector, in England it would be introduced following real term cuts to funding of 25% by the end of 2023-24. What's become clear too is that for pharmacists to be paid under the scheme, patients must meet stringent criteria.
Those 7 criteria were very niche, and a patient needs to meet a threshold. Even if I've done a 10-minute consultation and they don't meet the threshold, I can't claim for it. So I've done the work and I don't get paid for that threshold. And that's quite frustrating because I feel like the NHS needs to recognise the work that is being done, not just the fact that it meets a threshold.
In a statement, the Department of Health and Social Care said this government inherited a broken NHS where pharmacies have been neglected for years. They said pharmacies are key to making healthcare fit for the future as we shift the focus of the NHS out of hospitals and into the community. If the majority of the association's members vote in favour of working to rule, the action could start before Christmas, just as the pressure on the NHS increases.